I'm Mr. Partlow. Now we're going to move on to inspecting your elbow. Can you hold your elbow kind of up for me? Looks nice and well proportioned, no deformities. And I'm going to just palpate it. I don't feel any lumps or any masses, any pain or anything like that.
No pain.
I'm going to palpate for your Omicron process. It's just the tip of your elbows. I'm going to look at your lateral part of your elbows, palpate that, and your medial part, the inside of your elbows. Now we're going to do range of motion with your elbows. We're going to do flexion, extension. We're going to do pronation and supination. Now next, I'm going to look at your shoulders.
Oh.
It looked pretty aligned to me, nice and symmetric. I'm just palpate for any trauma, any lumps, any tenderness like that. I'm going to just palpate your suprasternal notch, move up to your HCG notch, and then your HCG notch, and then and move to your cortisoid process, and then move to your lesser tubercle and your greater tubercle. Now we're going to do range of motion with your arms. We're going to do flexion, arms up, extension, arms behind, abduction, and then adduction. Bring it towards your body. Now we're going to do something called the Speeds test. I just want you to hold your arms in front of you and make a fist, and I'm going to just push down on your wrist. Try not to let me push down. Any pain or anything like that?
No pain.
Okay, now I'm going to just have you stand up for me, Mr. Partlow, and I'm just going to just start. I'm going to look at your spine and look at your neck area. First, I'm just look at your neck area, nice and aligned. Your trachea looks pretty in line. Color is nice, appropriate for your race, and I don't feel any lumps or any lesions. No masses are palpated on that. Now I'm going to just have you turn to the back. Just look at your spine. Looks nice and symmetric. Looks like an S shape. Your curvature is pretty good. Now just have you bend frontwards for me, Mr. Partlow. Like I said, no deformities. It looks pretty in alignment. No scoliosis noted there. I'm just put my hands on your hip. Make sure your hips are nice and even. And now you just bend backwards for me for extension. Okay, perfect. Stand up. Do you have any pain, any spasms or anything like that?
No, it's just a little tight.
Okay. Now we're going to do your extension. How do you bend backwards for me? And then twist to the left and to the right. And bend down to the left and to the right for me. Okay, now Mr. Partlow, I'm going to have you come back and lay down for me. I'm going to just move on along, just assessing your hips. So I'm going to have you do flexion. I want you to bring your leg up for me. Each leg, other one. Then extension, I want you to roll on your belly and then bring your legs up that way as well. Perfect. Now, when you roll back over to your back, I want you to roll onto your side for me. I'm just going to palpate your hips, your hip. Just going to palpate your hip. Move down your sciatic nerve. Any pain there?
No pain.
Okay, now I'm going to have you roll back onto your back for me. We're going to do the straight leg test. I want you to raise one leg at a time for me and let me know if you have any pain or anything like that.
No pain.
Okay.
No pain.
Okay, perfect. Now I'm going to have you sit back up for me, Mr. Partlow. Now move down to your lower extremities. Just looking at your knees. Just inspecting. Everything looks good. I don't notice any trauma, no inflammation, no redness noted there. Just move down and I'm just palpate your knees. I don't notice any masses, any lumps, no deformities, any pain or anything noted. Now I'm just have you stand up and I'm just palpate for your fascia. That's just behind your knees. Any pain?
No pain.
Any pain?
No pain.
Okay, I'm going to sit back now. We're going to do the range of motion for your knees. I'm going to do extension, knees out. Flexion, back down. Abduction, away to your sides, and then adduction towards inwards. Okay, perfect. Now I'm just moving down to your feet and to your ankles. I'm just inspecting those. Looks like you have all 10 toes. Your feet look in alignment. I don't notice any swelling or any edema noted down there. Let me just move down. I'm just palpate your feet and your ankles, your calcaneus heel, both of them. Any pain or anything like that?
No problem.
And just palpate your joints of your toes. Palpate your joints. Any pain or that?
No problem.
I don't notice any deformities or nothing like that. Looks like you have a slight arch. Your foot looks kind of flat. Now we're just going to do range of motion for your feet. Extension, foot down, flexion, foot up, inversion, foot outwards, and eversion, foot inwards. Just have you move your feet in a circular motion for me, Mr. Partlow. And then lastly, when you were performing earlier your weight bearing, your non-weight bearing test, I noticed that you had good contour. Your legs and your feet were in alignment. I didn't notice any problems noted on that part. So that completes our head to toe assessment. Do you have any questions or any concerns?
No, I don't.
Okay, thank you. Have a nice day.
You as well.